As doctors warn of the pressures they're under today, it's emerged that GP surgery appointments offered in Sussex have hit record levels. Last year, 11.4 million were offered to patients in the county, about 800,000 more than in 2023. But in December, for example, only half were actually carried out by a GP. Why? Well, it's because other health workers like physiotherapists, paramedics, clinical pharmacists are playing a greater role in managing demand, as our health correspondent Mark Norman explains.
So how are things, Wendy?
Yes, I'm walking.
Wendy is having a scheduled appointment with her GP, but on another day, she might have been more appropriately seen by a pharmacist or a nurse practitioner or even a paramedic. As the demand on GPs keeps going up, so more GP practices are employing clinical staff to offer patients more appropriate alternatives.
There are cohorts of patients who still have a well-held belief that the GP is the person to see. And I think, that may well be right a lot of the time, but I think very often we're not the right people to see and we're not the best people to see. So that's really the key thing here, is getting the patients to the right person as quickly as possible.
At this practice in West Sussex, you can see your doctor, of course, but it might be a paramedic if you're very unwell, or pharmacists to check your medication, or even youth workers for mental health support.
So a clinical pharmacist's role in GP practice is to help optimize patients' medication. So to help them understand why they're taking it.
Where someone maybe has had something before, they want it again, can they have it again? Do they need a review? I maybe reduce the GP's workload by like 50% of those daily.
We deal with acute illness on the day for treatment planning and home visits and just things that need, or when patient isn't acutely unwell.
If you imagine now the number of available slots that we free up for GPs to do their work, we can also provide the young person time to talk, and that is often all they need.
There is a national plan to tackle the 8 a.m. rush to see a GP and for patients to know how their request will be managed. Having alternatives to seeing a doctor is one way of trying to achieve that.
Well, Mark joins me now. Mark, could this be the future for GP surgeries then?
Look, I think it is. I mean, getting an appointment is a priority for everybody. Not getting one is absolutely infuriating if you can't. But this is a demand-supply problem. We want more from our GPs. There just aren't enough of them to do what we want. It's all very well, too, if your GP practice has nurses and physiotherapists, mental health support workers. I think most of us would want to take advantage of that. But, of course, many GP practices simply don't have all that. And the NHS insists, too, this is not about not seeing your GP. Your GP is there. You can absolutely still get an appointment with them. And, in fact, the government today threw £900 million at the problem to try and improve that situation. But critics say it doesn't solve that basic demand-supply problem that I mentioned earlier.
Mark, thank you.